Growing pains can be very pronounced and worrisome for parents, because they make the parents fear that something serious may be going on. In this video, I will therefore explain what growing pains are and when parents should worry. About 4 out of 10 children occasionally experience growing pains, usually somewhere between the ages of 4 to 8 and sometimes even 12 years. Growing pains are exactly what the term says, pain as a consequence of the growing process and the immaturity or frailty of the child's body. To understand this, we need to realize how growth of a child occurs. A child grows through the long bones getting longer. The growth plates are responsible for this, and they are located at the ends of the long bones. They induce lengthening of the bones and therefore overall longitudinal growth of the child. The surrounding muscles and tendons, on the other hand, have no growth plates or growth nuclei. They become longer primarily because of the traction caused by the longitudinal growth of the bones. Or simply put, the muscles and the tendons stretch along with the longitudinal growth of the bones. As a result, the muscles and tendons actually always lag a little bit behind in length and are therefore always somewhat too short and under tension while the long bones are growing. In other words, longitudinal growth of the bones causes traction and tension on the surrounding soft tissues, the muscles, the tendons and the ligaments, which attach to the bone, and this triggers the pain. The vast majority of growing pains occur in the lower limbs, because these are obviously loaded more than the upper limbs. And the pain can be anywhere in the legs, since there are soft tissue attachments to the bone over the whole length of the leg. Usually the pain is located just above or below the knee, or just above or below the ankle, on one side only or both sides at the same time, or a mixed appearance on any of the locations that you see here in the drawing. Typically the pain occurs when the child is resting, for example in the evening or during the first part of the night, when the child suddenly wakes up and starts crying. Growing pains are therefore often very distressing for the parents, as the pain is sometimes very pronounced and nothing seems to help, while externally there is no trace of swelling or bruising, and there is not much special to remember from the day, other than the normal sports and playing activities that may have been a little bit more intense than usual, but which went without any problems or complaints. Fortunately, the pain disappears spontaneously, usually after a few hours, and the child sleeps peacefully afterwards. The next morning, all pain is gone, and it seems as if nothing has happened. And if you would take an ultrasound, X-ray or MRI, which by the way is unnecessary, these all would be perfectly normal. For treatment, there is unfortunately not so much you can do. Warm compresses or a warm bath or a localized gentle massage over the painful area can sometimes help to alleviate the pain. That is because growing pains often respond favorably to gentle tactile intervention, which is in contrast to many other causes of pain. Usually the pain subsides after a few hours, but sometimes it can take a while before the child falls asleep again, even up to 5 hours. If needed, paracetamol 15 mg per kilogram body weight may be given as a painkiller. Now, what is important is to realize that growing pains is a presumptive diagnosis, which means that based on the story and the absence of any other symptom, one suspects that it's growing pains, because there is no other sign of something else. Since if there were something else, then there should be other symptoms. So therefore, it is important to be sure that there are no other symptoms. No swelling, no local warmth, no local redness, no local hardness, no local bump, no fever, no sickness, no muscle spasm, no joint stiffness, no inability to move the hips, the knees and the ankles. And the pain should be gone next day. There should be no limping next day. And the night pain should not be there for more than 3 consecutive nights. If you have gone over this checklist and all that is right, that is good. It is growing pains and there is no need to worry. You can be reassured as a parent. Now often I still get the question, even if none of these other symptoms are present, could it really not be something else? For example, the beginning of something very serious, like leukemia, a bone tumor, juvenile arthritis, septic arthritis, osteomyelitis, or anything else? The answer is no, because in all of those conditions, there are always other symptoms of the list that I have just shown you. In case there are symptoms of that list, then indeed further investigation is required, and you should make a doctor's appointment at the first possible occasion. Thank you for watching.